So, what are the key challenges that providers face as we move into 2021? We recently conducted a survey of senior healthcare decision makers responsible for patient access, examining their challenges and goals. And the research was a mixture of qualitative interview data and a quantitative online survey. All respondents came from hospitals or health systems with typical appointment volumes of more than 25,000 visits a month. And the survey was carried out in October, just as many were hitting the second wave. The majority were conducting some form of virtual care, 92% agreeing that virtual care offers high value to patients, and 74 think that it's an excellent patient experience. However, more than half also said that it now requires significant improvement to integrate into the care delivery process more holistically. In some cases, virtual care was even identified as a cause of increased care team burnout, with around a fifth of providers indicating this. The challenges of developing a protocol-driven, system-wide approach to virtual care is a theme that we're hearing a lot of in the market at the moment, and the shift to virtual care has been predominantly welcomed. But there's clearly more that needs to be done to integrate it into the existing workflow and to make it more sustainable across the organization. The challenge providers face as they consider the sustainability question is that whilst telehealth allows medical staff to see patients remotely, there remains a fundamental disconnect between the consultation and the siloed processes, teams, and technology which support it. Patient access leaders are aware of this, and when asked about the key obstacles that prevented them from achieving their goals, fragmented care processes were the leading pain point ahead of budget or staff productivity. So it's little surprise that process improvement and streamlining workflow is their top goal for 2021. This also presents as a revenue challenge. It's becoming increasingly apparent that telehealth consultations cause revenue attrition around the consultation, as follow-up orders, pharmacy fill, and other events that would normally take place inside the four walls are now either not taking place or taking place elsewhere. So what does this fragmentation mean for the patient? It manifests in ways we're all anecdotally familiar with. Multiple points of contact given to a patient with multiple people calling to get the same information, insufficient material at their fingertips when they need it, and a lack of continued relevant support throughout their journey. Now there's an added burden of inconsistent follow-up experiences being made worse by having to take care of things that would otherwise have been managed inside the visit itself. Telehealth appointments have been layered over existing foundations that have already been fragmented. And a recent patient study conducted by Kairos, for example, showed less than half of patients said they left their virtual visits knowing what the next steps were. The point is that coordinating the digital communication around the visit is just as important as getting the video visit right itself. A good patient journey, whether virtual or in person, doesn't begin and end with the consultation or video call, to say nothing at all of the problem of ensuring that the call itself, in the case of a video visit, is delivered in the right context, i.e. safely by the right person, over the right channel, and at the right time in the care journey. The core challenge this creates for access centers is an increasingly difficult care coordination problem that requires the effective navigation of patients along a unified care journey that can rapidly adapt according to new evolving circumstances. COVID-19 has shone a spotlight on problems, presenting new operational challenges that access centers just weren't ready for. 2/3 of our respondents experienced increasing call center volumes during the last 6 months, while half have also seen an increase in the average length of time required for each call. Interviewees told us that patient access centers are now on the front line of dealing with COVID-related questions, as well as juggling virtual, over the phone, and in-person appointments. And although there's now more capacity in the schedule due to reduced demand, one provider shared that prior to COVID, it used to take an average of 3 calls to book a patient in, and now it's taking around 6. Patient access centers are not set up to handle this complexity. 40% of our respondents, for example, are unable to achieve their KPIs because clinical staff have limited availability to support the contact center. The needs of the patient have evolved to being clinical and administrative together, and the patient access center hasn't yet caught up. A high volume of manual repetitive tasks is another side effect of this problem. COVID has generated more rescheduling requests from patients concerned they may have the virus, or indeed wanting to reschedule until community transmission rates have dropped. A third of providers still handle rescheduling manually by asking patients to call in, creating extra work for access teams, and quite frankly, not creating a convenient experience for patients. Further, when patients do cancel, trying to fill their original slot can be a lengthy process. For more than 7 out of 10 providers, again, this equates to staff manually calling patients on a wait list, with very few having the tools to automate this. It's worth noting that our respondents think hybrid models of care delivery will be the norm for at least the next 12 months, and this means that they need to easily determine what channel of care is most suitable for any given patient and orchestrate better experiences around both in-person and virtual visits to instill confidence in safe and consistent care delivery.